Start or wait?
Start,
Oh,
it's okay, sir.
yes, you can start, sir.
13 students. Yesterday class we done about anti-muscarinic drug. We finished the drug blocking muscarinic receptor, okay? Atropine, benzotropine, ipratropium, copolamine, hyoscine, copacabamide, so many names, yes, many music. Now, today we start about neuromuscular junction blockers, the receptor NM, okay, present at skeletal muscle. Neuromuscular junction blocker drug we categorize into two groups: depolarizing, depolarizing neuromuscular junction blockers. Depolarizing neuromuscular junction blockers, how they working? Synapse, skeletal muscle, acetylcholine release here, yeah? Here we having a receptor. Which receptor? NM receptor. NM receptor attached with a gate, sodium gate. Okay? The drug we use here, the depolarizing group, only one drug, succinyl choline. Succinyl choline. It's very similar to acetyl. Acetyl having two carbons, succinyl having three carbons. Okay, three or four carbons. So nearly same thing. Acetylcholine. So it means the same thing like succinylcholine, same formula, same chemical structure like acetylcholine. Now, if you give as succinylcholine to patient, this one green in color is succinylcholine. Here we having acetylcholine. Okay, this acetylcholine after attachment with receptor, when function finished, the breakdown done by acetylcholine esterase. Understand? Acetylcholine esterase. But this succinylcholine we use from outside. We use as a drug. Yeah, we give to patient from outside. This succinylcholine which we use as a drug, we giving from outside. Now this enter to body at neuromuscular junction. This succinylcholine attach with receptor. Can you break it with acetylcholine esterase? No. Okay. The succinylcholine attached with receptor. Now the succinylcholine continuously stimulating. Doing what? Continuously stimulate which receptor? NM receptor. What happened next? Opening of sodium gate. Clear? The sodium gate open, the muscle depolarize. Muscle depolarize. Then after depolarization, muscle start contraction. This is a skeletal muscle, okay? Muscle start contraction. Muscle depolarize. This drug continuously stimulating this succinylcholine, okay? Continuously stimulating this receptor. I already explained one terminology about nicotinic receptor. If you continuously stimulate nicotinic receptor, what happens with the receptor? Nicotinic receptor become inactive. Understand? This drug continuously attached with this receptor. Okay. First depolarize the muscle. First muscle contraction there. Then after some time, no more sodium get open because receptor become inactive. When receptor become inactive, what is this terminology? In pharmacology, we use term tachyphylaxis. What is tachyphylaxis? Receptor not give response to drug. Okay, if a receptor not give response to drug, it's mean terminology we use here tachyphylaxis. Understand? So succinylcholine continuously stimulates the muscle first. It means succinylcholine, how succinylcholine is working. Succinylcholine work in two steps. Step number one, succinylcholine first excite the muscle. Okay, first excite muscle, then it lead to contraction. Understand? Step two, succinylcholine when continuously stimulate the receptor, then what happen? No response, then muscle paralyzed. In second step, muscle paralyzed, muscle relax, no depolarization. Understand? So first depolarization done, lead to contraction, then no more response. Why? Because succinylcholine continuously stimulates nicotinic receptor. Understand? Nicotinic receptor undergo inactivation, tachyphylaxis, so no more response. So this drug work in two steps. Okay, first excite the muscle, then paralyze the muscle. Understand? First excite the muscle, then paralyze the muscle. So what happens if you excite the muscle? So this drug now having very limited use. This drug we use only for short surgical procedure. Short surgical procedure. If you want to put endotracheal tube, so we having muscle there, pharynx muscle, yeah, then and larynx muscle. So these muscle must relax. Then very easy to put endotracheal tube for short surgical procedure, not for longer duration. Okay, endotracheal tube. If you want intubation of trachea, if you give succinylcholine, pharynx muscle relax, larynx muscle relax, very easily you can put endotracheal. Succinylcholine will not apply for longer procedure, okay? Because succinylcholine doing what? First excite the muscle. So what are the side effects? What are the side effects? Okay. So when you bring the exercise, what happens with your body? Body temperature.
Increase.
Yeah. So succinylcholine doing what? First excite the muscle. Yeah. All body muscle contraction there. So what happened? Body temperature increase. It lead to hyperthermia. Lead to hyperthermia. This hyperthermia is dangerous. Malignant hyperthermia. Malignant. Oh, very high temperature. Okay. Malignant hyperthermia is a one side effect. Understand? Malignant hyperthermia, one side effect. Another side effect. When muscle start contraction, okay, muscle release potassium. Muscle release potassium outside. Muscle cell release potassium. Understand? When you're doing exercise, your muscle releasing potassium. Potassium mostly inside the cell. Potassium inside the cell very high. So if muscle release potassium, what happened with potassium? Potassium high. Clear? Potassium high. Understand? Potassium high. Hyperkalemia. Another side effect. It's very dangerous side effect. Hyperkalemia because it excites the muscle first. Hyperkalemia. When you use your muscle very rapidly, now you're sitting now, you never run in 1 month, just 1 or 2 times doing exercise. So what happens with your muscle? Muscle fatigue, yeah? The muscle producing what? Lactic acid. Lactic acidosis. muscle release lactic acid. All these things, why this happen? Because this drug first excite the muscle. Understand? Strong excitation, then relaxation. In step one, doing what? Excite, depolarize. That's why this group known as depolarizing neuromuscular junction blocker. They first depolarize the muscle, then muscle fully relax. Okay, then no more response, then the muscle paralyzed. So this drug work in two phases. Step one, step two. Step one, excite the muscle strongly, then relax the muscle. Understand? So this drug having more side effects. Having more side effects. Can you use if patient having? Keep in mind very important thing here. If patient having renal failure, patient having renal failure. Can you use this drug in renal failure patient? Renal failure patient wants surgery. Yeah. So you need to give these are the anesthetic drugs. You want to intubate trachea. Okay. You want to use succinylcholine. If you use succinylcholine in renal failure patient, what happened with renal? Already potassium very high. In renal failure, potassium already very high. In renal failure, already patient having acidosis. The patient can die due to hyperkalemia. Patient can die due to acidosis. Understand? So not used in renal failure patient. Succinylcholine contraindicated in renal failure. Understand? Succinylcholine if patient having renal failure, then also take care in case of liver disease. Also take care in case of liver disease. Liver disease also pH also disturbed. Lactic acid. This lactic acid come from muscle. Lactic acid where going? Lactic acid coming from muscle. Muscle give you lactic acid. This lactic acid going where? Liver. Liver change it to glucose. So if your liver is not working, liver disease, liver not working well, yeah. So what happened? This lactic acid, high, high, high. What happens in our body? Acidosis. Done. So in renal failure, liver disease patient, succinylcholine contraindicated. Understand? Succinylcholine contraindicated. Another patient, number one, another patient. Acetylcholine. What is the location of acetylcholine esterase? Where present?
and
Where
MG
this enzyme present? Where?
and MG.
No, it's present mean it's present in synapse everywhere. Yeah, where you use acetylcholine, and also at neuromuscular junction, it's present in synapse. Yeah. So another enzyme, pseudocholine esterase. Which enzyme? Pseudocholine esterase. Pseudocholine esterase come from liver. Pseudocholine esterase produced by liver. Okay. This pseudocholine esterase enzyme. This enzyme can break. This enzyme can break succinylcholine. If succinylcholine in blood, so this enzyme can break succinylcholine. Clear? So now you can understand. If patient having liver disease, another problem. This succinylcholine pseudocholine esterase is not coming. Yeah. So the breakdown of succinylcholine will decrease. So what happens? Succinylcholine level will increase it. Yeah. So this succinylcholine doing what? Excitation of muscle. It can lead to acidosis. It can lead to hyperkalemia. It can lead to hyperthermia very easily. Can produce more side effect if drug accumulate inside your blood. Yeah. So it's effect. So in liver disease, in renal failure, the drug must be contraindicated. Understand? In liver disease, In liver failure, drug must be contraindicated. Some patient, number 3, renal failure, liver disease. Number 3, contraindication, patient have deficiency of pseudocholine esterase, pseudocholine esterase enzyme deficiency. The patient having genetic deficiency of pseudocholine esterase. If patient having genetic deficiency of pseudocholine esterase, then can you break this succinylcholine in blood? Of course not. So then again, succinylcholine level again high, it can produce lot of side effects. Understand? It can produce lot of side effects because you're not able to break it. Yeah. So succinylcholine can get accumulated inside your body and can produce more and more side effects. Understand? So these 3 contraindications: renal failure, patient having renal failure, patient having liver disease, liver failure, patient having pseudocholine esterase deficiency, pseudocholine esterase deficiency. In these 3 situations, if you want to use succinylcholine in patient to putting endotracheal tube, yeah, before before the invention of other Curry family, the non-depolarizing neuromuscular junction blocker, in that time we just have the succinylcholine for anesthesia to relax the muscle, body muscle. But this succinylcholine producing lot of side effects. Okay, the important side effect must keep in mind: hyperthermia, malignant hyperthermia, and this very dangerous side effect, hyperkalemia. Hyperkalemia can lead to cardiac arrest. It's not good for heart. High potassium in body damage your heart. Very high potassium in body damage your heart. High potassium is cardiotoxic. Okay, so hyperkalemia is can be life threatening. Understand? Till here clear or not? Okay. So if you want to use succinylcholine, liver must be intact. Liver must be function good. Yeah. Kidney must functioning good. So kidney can eliminate extra acid, kidney can eliminate extra potassium. But how you control this? Okay, another patient, another person, the renal function. If the person renal function was good, if renal function very well, yeah, kidney performing its duty very well. So kidney can eliminate extra potassium, kidney can eliminate extra acid. So this acid and potassium, kidney can eliminate. So no problem with the patient, yeah, because kidney function very well. Liver, now the patient liver function very well. So liver also help to metabolize this drug. Understand? So only one side effect left. Which thing? Hyperthermia. Hyperthermia. So how you control this? If patient, you give succinylcholine to patient and patient now showing hyperthermia, how you can control it? Give cold blanket. A cold blanket to reduce body temperature. Okay. Another drug we use. Keep in mind this drug name, dandroline. Dandroline. Dandroline is a calcium blocker. Calcium blocker, that calcium channel present in sarcoplasmic reticulum. So already know the calcium for muscle contraction come from sarcoplasmic physiology. Yeah? Calcium for muscle contraction come from T tubule, sarcoplasmic reticulum T tubule physiology. Yeah. So, but if you block this, dantrolene doing what? Block calcium. Yeah. If you block this, so if succinylcholine depolarize the muscle, then how the muscle contraction there? First depolarization, then calcium release, from sarcoplasmic reticulum. Okay, then contraction. Succinylcholine doing what? Depolarize the muscle. If you give dantrolene, can dantrolene allow this calcium to come out? No. Then no muscle contraction, no hyperthermia. To control hyperthermia produced by, if you want to use succinylcholine, we know succinylcholine causing hyperthermia, yeah? So we can use cold blanket in a patient to reduce the body temperature. Be ready, you must wear these things, yeah? You must have dantrolene. Dantrolene can block the release of calcium from the muscle, so no more muscle contraction, no more hyperthermia. If no more muscle contractions mean also the potassium not released, lactic acid not released. So this dantrolene is very effective. Okay, dantrolene used in combination with succinylcholine. Understand? This drug done depolarizing neuromuscular junction blocker, only one drug, succinylcholine. How succinylcholine relax your muscle? In two steps. First excite the muscle, then paralyze the muscle. Clear? Then sodium channel totally blocked. Why? Because if you repeatedly stimulate, because you're repeating, yeah, if you repeat stimulation of nicotinic receptor become inactive. Then muscle paralyzed, then muscle relax. Understand? So just because of these side effects, hyperthermia, hyperkalemia, lactic acidosis, just because having these side effects, the limited uses of succinylcholine. We have other safe drugs, too many safe drugs here. Okay, the limited uses just for short surgical procedure. Just for short surgical procedure, like to give example, endotracheal intubation. If you want to use this procedure just before giving anesthesia, we put endotracheal tube for breathing purpose. Okay, we're using succinylcholine to relax the neck muscle. Understand? Succinylcholine first relax facial muscles, then relax upper limb muscle, then relax lower limb muscle like this. The second family, this done, everything done about succinylcholine. In renal failure, in liver failure, in pseudocholinesterase deficiency, in these three patients, not use succinylcholine. If you still use succinylcholine in renal patient, it can induce very strong hyperkalemia, too high your pH, lot of acid in your body, which can make worse. Understand? So already producing side effect. So how you can control the side effect of succinylcholine? Kidney must function well, not renal failure patient. Yeah, if the kidney must function very well. If liver intact, kidney intact, yeah, they perform function normally. Then you easily can use succinylcholine. The only thing left, one side effect, hyperthermia there. How you control hyperthermia? Cold blankets, reduce the room temperature. Okay, a cold thing you cold ice, cold blanket, these things, and the drug can control the action of succinylcholine, dantrolene. Dantrolene, dantrolene can block the calcium channel inside the muscle, so the temperature reduce. Understand? Second group, non-depolarizing, non-depolarizing neuromuscular junction blocker. Okay, non-depolarizing neuromuscular junction blocker. Depolarizing, they first depolarize the muscle, then block the muscle. Yeah. Now, non-depolarizing, how they working? In this family, we have in first by the name Curare family, Tubocurarium, Tubocurarium, Mivacurarium, Mivacurarium, Tubocurarium, Mivacurarium, Rivacurarium, Curarium. pancuronium. Pancuronium. So it's this family, Curare family, okay? Just these 4 5 names, and a big list. The word here, Curare, coronium. So these drugs come from where? What is Curare family? The Curare word, it is plant, it derived from plant. It's a toxin. Before, let me go. Before the people, the hunt for hunting animals, they're using arrow. Yeah? How they hunt the animal? They're using this plant toxin at the arrowhead. Then they shoot the animal, or animal paralyzed. They can't move. Understand? The curare is the plant toxin. What is done with the animal, the muscle of animal paralyzed. Yeah? They can't run. Why? What happened? Just because of this poison. This is a toxin. This toxin is used for hunting animals. Hunting animals. Understand? So now the pharmacy, the pharmacology, the where they use this chemical in medicine, in clinical science. So these drugs come from, so that's why we give a name to this family, Curare family. Curare family. Curarium, Curare is a plant, okay? This toxin, this chemical, this drug comes from plant. Curare family. How they working? How they working? Non-depolarizing neuromuscular junction blocker. How they relax your muscle. In synapse is a receptor, N M receptor, sodium gate. So now the Curare drug, how Curare drug is working? How Curare drug is working? Here we having acetylcholine, okay? Now there's a competition between acetylcholine and Curare. It's a Curare. This Curare come here, this Curare attach here, okay? This Curare attach here and block this receptor. Understand? If you directly go, what acetylcholine doing? On opposite, on another hand, acetylcholine want to excite, clear, and Curare want to inhibit. Now there's a competition between these two. So Curare family known as competitive inhibitor. Understand? They compete. Competitive, competitive inhibitor. They inhibit, in biochemistry, competitive enzyme inhibitor, non-competitive inhibitor. Yeah, the competitive inhibitor. So they compete with acetylcholine, okay, and they block the receptor. When they block the receptor, can you open sodium channel? Of course not. If sodium not come inside the cell, is it possible to depolarize the muscle? Can you depolarize? Of course not, yeah. So because you block this receptor, if you block the receptor, sodium gate close. Sodium gate not open, yeah. So it means muscle not depolarized. That's why known as non-depolarizing neuromuscular junction block. They exciting the muscle first? No. They directly block the receptor. Understand? They directly block the. Can they produce hyperthermia? No. Can they produce hyperkalemia? No. Can they produce lactic acidosis? No. So these side effects not present there. Yeah. Succinylcholine first excite the muscle, mean first depolarize the muscle, then paralyze the muscle. Yeah. These drugs directly inhibit the muscle, directly block neuromuscular junction blocker, directly block neuromuscular junction. Understand? These drugs, Curare family, directly block neuromuscular junction. Understand? They not allow depolarization of muscle. If no depolarization, then what happens with muscle? muscle relax. Relax means muscle paralyzed. Okay. These drugs, what is the use of these drugs? Use use before surgery in anesthesia. Okay. If you want to open abdomen, I have abdominal muscle. If you have pain in your muscle, muscle very tightly contracted. Yeah. You're feeling pain in leg, muscle cramp there. Yeah. So if you have pain stimulus increase muscle contraction. So in surgery, we also use muscle relaxant. Must use. Otherwise, if you stitch the abdomen, again abdomen open. The stitching of the skin, that stitches we use can't hold because strong muscle contraction. We need muscle relaxation. Clear? So in surgery, we need muscle relaxation. Muscle relaxation. So for that purpose, we use what? Kureri family. Understand? For that purpose, we use what? Kureri family. Done? Okay, this we use in the muscle relaxation we need in surgery. Understand? Before surgery, we will give what? Anesthesia. Before surgery, we give what? Anesthesia. So in anesthesia, we're using Kureri family. Done? To relax some muscle. So very easy to perform surgery. And after surgery, when you again close the skin, okay, you stitch the skin. There's no muscle contraction. The muscle very easily skin will be proximate with it. The stitches can hold the skin. Understand? So in the surgery we use muscle relaxant. These muscle relaxant will help, okay, in surgery. It's a drug. These muscle relaxant we mostly use in surgery. Understand? So in surgery, after surgery, we need to use antibiotic because the person having the wound there, yeah? Person
Sir,
having wound, the
we start the
surgical wound.
class. It's
Okay,
time for okay.
we start.